Yeah, I'll start with a bit of background. See, if you look at healthcare in India, in rural India, everybody will talk about how there aren't enough doctors. Now, how do we bridge this gap? Thirumalai Mission Hospital offers a very unique opportunity by already having a very wide network into the community that they serve. Therefore, we actually can, with the help of the family care volunteers and the multipurpose health workers, make sure that good quality health care reaches the people. There is this big vacuum in terms of secondary health care, and this definitely needs to be filled up. And Thirumalai Mission Hospital and Thirumalai Charitable Trust are taking steps to fill up this vacuum in our area. Actually, considering that obesity, hypertension, diabetes, osteoporosis, osteoarthritis of the knees are the commonest problems that we see in this community that we serve. I think the most important management that we need to be able to provide is to bring about a change in lifestyle, and this is actually one of the most difficult things to do. Change in lifestyle can only be done through proper education, and you need to educate entire families, because you'll find a clustering of these problems within a given family, and that has to do with poor lifestyle. So if you educate the whole family about lifestyle, you will be of service not only to the older generation who are afflicted, but you will also be of service to the younger one who are potentially going to be afflicted. Yeah. Uh, at Thirumalai Mission Hospital and with TCT, it is a very simple model. You have the hospital, you have the medical personnel, including doctors there, and you have the community in which we have a large number of healthcare workers. And we are making sure that the community accesses healthcare at the hospital when needed, and the hospital in turn is able to take the help of these community health workers for providing effective care and monitoring for chronic disease. That would be to put in place a system of education for all the people who have these problems, a system of monitoring to ensure that, if there is a diabetic, he needs to have his blood sugars monitored periodically to know that things are under control, blood pressure measurement. It is quite possible for us to train up family care volunteers to measure these parameters. And so long as they are given an idea of what are the cutoff levels beyond which they need to refer the patient to the hospital, that will be a very good system, because problems can be identified early, and when things get a little out of hand, people can actually access medical care. And minor changes done during these times will go a long way towards reducing morbidity and mortality. See, in India, voluntary agencies like TCT and Thirumalai Mission Hospital can only set up a model in the area where they exist. And what we are hoping is that this model will work so well that other places will start following what we do, and in the long run, you will have a large number of such institutions working, which will be to the benefit of the rural communities in India.